Hi, I'm Tara Schmidlin, one of the CPMC genetic counselors. Before you view your results, I want to give you some information about what the results can and cannot tell you. When viewing your results for any condition, it is important to remember that the testing done as part of the CPMC study only looks at disease risk. CPMC test results are not a medical diagnosis. Systemic lupus erythematosus, commonly known as lupus, is an autoimmune disease. Autoimmune diseases are conditions in which the body's immune system, which normally fights infections and viruses, is misdirected and attacks the body's own normal, healthy tissues. Lupus can affect any organ system in the body. The most commonly affected areas of the body include the skin, joints, kidneys, blood vessels, brain, heart, and lungs. Although lupus can be diagnosed at any age, most individuals are diagnosed between the age of 18 and 45. Lupus is more common among women than men, and more common in African Americans and other non-whites compared to Caucasians. People with lupus have episodes of symptoms which are referred to as flares because the symptoms can start and stop sporadically. Some people with lupus will go into remission and have no symptoms for long periods of time. Symptoms can be different from one flare to the next. Some of the most common symptoms of lupus include a butterfly-shaped rash on the face, fatigue, fever, weight loss, joint pain and swelling, chest pain that occurs with deep breathing for several days or weeks, a rash that occurs from the sun which is not related to sunburn, white discoloration of the fingers and toes that occurs in response to cold, which is known as Raynaud's phenomenon, acrocyanosis, a bluish or purple coloring of the fingers and toes, which occurs occasionally, and hair loss. It is important that you tell your doctor if you're experiencing any of these symptoms. There are many factors that could make up your overall risk for developing lupus, some of which you can control and some of which you cannot control. The primary risk factors for lupus include being female, being African American, and having a family history of lupus or other autoimmune diseases like Crohn's disease, type 1 diabetes, or rheumatoid arthritis. Genetic risk factors can also contribute to your risk of developing lupus. Non-genetic risk factors like smoking cigarettes can also contribute to your risk. Additional risk factors may include early childhood infections, medication allergies, and exposure to chemicals used in manufacturing pottery, ceramics, and glass. We mentioned genetic risk factors as contributing to the risk of lupus. It is estimated that about 44% of the risk of lupus in the Caucasian population is due to differences in genetic risk factors, while the remaining 56% of the risk is due to differences in non-genetic risk factors. It is not possible for lupus to be diagnosed by genetic testing. Lupus must be diagnosed by a rheumatologist using clinical and laboratory diagnostic criteria that have been established by the American College of Rheumatology. Now let's talk more about your CPMC result and genetic risks for lupus. Remember that we all have 2 copies of every gene. We inherit 1 copy from our mother and 1 copy from our father. This means that for every genetic variant in the CPMC study, you can have either 0, 1, or 2 copies. Your CPMC results will tell you how many copies of this one genetic risk variant you have. Having 1 or 2 copies of a genetic variant increases your risk of lupus compared to individuals who do not have any copies of the genetic risk variant. Remember, lupus is a complex disease. This means it is caused by a combination of variants in multiple genes as well as the environment. No single genetic variant causes lupus, so no single genetic variant will completely predict your risk for lupus. Results of CPMC testing alone do not diagnose lupus or rule out the chance of developing lupus in the future. Genetic variant information can help estimate your risk of lupus. However, other risk factors, like your family history and your smoking status, may have a greater impact on your risk than any individual genetic variant. We may learn of other genetic variants that influence your risk of lupus in the future. As we learn more, your estimated genetic risk for lupus may change. We'll keep you updated on changes through the CPMC web portal. For more information, consider sharing your CPMC results with your healthcare provider. You can also contact a CPMC genetic counselor, read information on the CPMC health condition page, or attend a CPMC educational event.